A lot of people have heard of the term voice therapy and don't actually know what that is. Is it exercises? Is it voice rest? In today's video, I'm going to walk you through what happens in voice therapy and why it works. I'm Christine. I'm a speech pathologist, vocal health and performance coach, and trained opera singer, and I help speakers and singers build a strong and reliable voice that they can feel confident about. So if that's something you might need, make sure to subscribe. At its core, voice therapy is about helping your voice feel and sound better. Think of it like physical therapy, but for your larynx, for your voice. And most people don't seek out voice therapy randomly. They seek out help because they're struggling with their voice. Most of the people I see, they come to me with either discomfort in their throat or tension when they speak. They get hoarseness, their voice goes out by the end of the day. They're singers and now their vocal range is reduced. They're not able to hit the high notes anymore, or when they're singing in the range, the voice is a little bumpy. And others, they just fatigue very easily. And all of these are symptoms that can be very, very stressful, because if you rely on your voice on a daily basis, but your voice is not showing up for the way you need it to, that can definitely have an impact on your confidence, in your overall performance, and in your daily life. Because if your voice is limiting you to the extent that you cannot even communicate when you go, with your friends or family, let's say you go to a restaurant, but you can't engage in a conversation because your voice is just fried. You're tired, or it hurts when you talk, you can't project. All of these are things that are symptoms of the voice and that can really affect the quality of a person's life. What voice therapy really does is looking at the root cause of a vocal issue. Some people come to me because they've had vocal fold surgery and they need to learn they're on recovery with their voice. Others, they come to me because they definitely want to prevent having surgery or needing surgery. And let me just be clear, if you have a voice problem, it doesn't mean you need to have surgery. What voice therapy does, basically, it looks at the voice from a functional perspective. Are you able to talk all day? Are you able to project? Are you able to sing your full range? Are you able to sing as much as you can? And if so, does it feel good and comfortable? That's the ultimate goal. And if there's fatigue, if there's discomfort, if there is strain, all of these are symptoms showing up that tell us something is going on at a deeper level. And once we've identified them, then we know what needs to be realigned, or if the voice needs to be retrained, if there's things that need to be eliminated in terms of vocal hygiene and so forth. So that's why once we look at the full picture of what's impacting the voice, from there we can come up with a really clear plan on how to get your voice back on track. The first step of doing voice therapy is an assessment. The initial assessment really looks at all the pieces of the puzzle. We'll put them together, and then we get a lot of clarity. And also, for the person that comes to me, learning about how the voice really works and what are the factors that are impacting the voice is extremely powerful, because once you know what are the contributing factors of the symptoms that you're experiencing, then we can start eliminating them and retraining things. And once you have that knowledge, that gives you the power, and then you're going to get the tools to change that. And that's what gives the lasting effect. And that's where the confidence in the voice comes back. That's where the sustainability comes back. And that's where your voice becomes reliable again. So that's what happens in the initial assessment, looking at what the voice needs. And then comes in the training aspect. It's not about doing more. It's about doing the right things for your voice. It's combining the science of the voice and combining that with the functional aspect of your voice in daily life and how to apply that. So instead of guessing, you're working with an understanding of what your voice really needs. And when your voice is set up right and you know what to do, that's when the ease and comfort kicks in. And that's what makes a lasting voice. And once that shift happens, using your voice becomes a lot easier. It lasts longer. It feels a lot more reliable. And that's a huge relief for people, because it doesn't just change how your voice sounds, but it changes how you show up in your daily life, at work, in performances. That's when the confidence kicks in, I see it over and over again, and I love seeing that transformation that people experience because now they are in control of their voice and they don't need to have more exercises or more warm-ups. They now know what to do with their voice, and having those tools is essential for a sustainable voice. So if your voice is not doing right now what you want it to, don't ignore it. In most cases, the voice can improve in a fairly short time too, when you address the right things. If you want to understand what's going on with your voice and what to do next, reach out to me. I'll drop the link below. And if you found this helpful, make sure to subscribe. There's lots more goodies to come.